Welcome to the NFP podcast, where we explore the empowering world of natural family planning. I'm Amy Smith. Join me and my co-host Emily Appledorn each week. Together, we're here to dive deep into the science, the stories, and the spirituality behind NFP. Every week, we push back against the free love culture and advocate for a culture of responsible love, where intentionality and respect are at the forefront of family planning. Join us as we discuss everything from the practicalities of charting and fertility awareness to the profound impact NFP can have on relationships and communities. Whether you're new to NFP or a seasoned pro, our podcast is your go-to resource for honest conversations, expert insights, and real-life experiences. So grab a friend, settle in, and get ready to be inspired. This is the NFP podcast. All right, guys. So last time we talked about what IVF is. We spent a lot of time on that topic of what IVF is and why, as Christians, it's not a viable, ethical option for us who are trying to achieve a pregnancy and are struggling with infertility. And so if you want to catch up on that, you can go back to that episode and listen to that, all of that. So today, Emily and I wanted to kind of not counter, but I guess provide more hope, that we talked about last episode, but by really giving you some resources and insights and our experience, so that way you can walk away from this episode with maybe some different tools and options, because it is, very disconcerting to hear words like unexplained infertility and to have all the blood work done and to have doctors look at you and say, everything looks great. I don't know why you're not getting pregnant. Or to hear, which I've heard these things, or to hear your only option is IVF. You're likely your only option is IVF or some type of artificial reproductive technology.
Right.
And so thanks be to God, that is not the case, that is not the only option. And that in a way, I would say I'm not a medical professional, obviously, so take it with a grain of salt. But I don't believe that there is something as unexplained infertility, because there's a reason. There is a reason. And maybe just the tests that are being run, what's being looked for, how the cycle is understood by the medical professional. And therefore, they're based on their understanding of how the cycle works and how the body works and the tests that they've run, they are not seeing where the problem is. But that doesn't mean that, you've exhausted all your options. And I do want to just say I really empathize so much with the person sitting in the medical professional's office and seeing the white coat and hearing from them, I don't know. And you obviously as a patient don't know either. And just feeling the sense of like, well, then what the heck am I going to do? Because the professionals don't even know what to do with me. And yeah, anything you want to say about that?
I was just going to say that feeling of despair.
Right.
Maybe it doesn't hit immediately because it's a little confusing in that conversation, because you're not expecting somebody to not be able to help you. But because there's so many women and couples, that most couples that are experiencing some sort of infertility, unexplained or not, because there's so many couples that those couples, it seems like, end up knowing or hearing about or whatever, I don't think anyone is necessarily surprised when that conversation happens, because you hear of all these other couples that happens to. So it's like, why would that not happen to me too? Just get this stamp of, we don't know. And so after that, you come away with a lot to process, but actually no answers to process. So you're processing your emotions and the thoughts that come up of what that road would look like if you decided to pursue that, or what it looks like if you don't. And there's really you don't have any clear answers about anything to explain what's going on. That's really hard, because we're always seeking knowledge and information, whether it's about ourselves or about anything that we're doing. And so when you're just left at a standstill, our bodies naturally don't really, it's hard to swallow that.
hmm I think this goes back to, my opinion, why it's so important for young girls who are in that stage of maturation to not have synthetic hormones interrupt the maturing of their cycle, of that communication between their brain and their ovaries. And then to couple that with teaching young girls and even young boys, right? Like just teaching young people about how their bodies work and having the goal of our medical, you know, culture be one of preservation.
Mm.
That we should be seeking to preserve the ovulatory event during the adolescent years and throughout a woman's reproductive life, because the hormone communication, this system that is the orchestra, right, that is functioning throughout the month, every month of a woman's reproductive life, is contributing to her overall health. That it's not an isolated, system in the body. Really, none of the systems in the body are isolated, right?
Mhm.
And especially and the reproductive system. So I know, Emily, you have worked with these women, and I have worked with lots of women who come to me in their 30s who are crying, who never knew this information about their bodies, who are now really ready to get pregnant yesterday and are not able to. And they've been on the pill for maybe 15 years or 20 years or 10 years, whatever it is, because they've had painful periods. And so the doctors put them on their pill, and that was it. And it was a great Band-Aid. It helped manage symptoms. They weren't in pain anymore, all good things. But then they come off the pill and that problem is still there because it was never corrected. It was never fixed. The root cause was never addressed. And now they want to be pregnant. And now we're having to first, before we can get to that point, we have to go back and fix the underlying cause that's preventing you from achieving a pregnancy. And this is why on the last episode, we talked about the effectiveness rates of artificial reproductive technologies and how they vary so much because the underlying causes of infertility vary, because some of them are easier to correct than others. So I have hypothalamic amenorrhea. In a nutshell, I overexercise, I undereat. My hypothalamus was in a very stressed state. I did that for so long, starting in my reproductive years, the maturation time when I was a teen. And my body just went into complete stress panic mode and was like that for a very long time. That became, quote unquote, the normal. The solution to that, so I could have, that's the case, right? I had HA, is what it's called, shortened. Can go through IVF. I can do all the treatments, all the things, and I could maybe get pregnant because there's nothing wrong with my tubes. There's nothing wrong with my uterus. There's nothing wrong. My hormones are just not communicating well because my brain is so stressed out. And really all it is if I stopped exercising and I ate a little bit more, I rest a little bit more, well, my brain turns back on because it thinks it's safe now. And now I ovulate and I can get pregnant and it's just fine. And they're saving me, $12,000 plus. And so, but that also requires a lot of willingness to change lifestyle, right? And some of these underlying causes of infertility require more of the patient. And we know this in other areas, right? Other diagnoses also can be fixed in a quote unquote natural way, but they require behavior change. And behavior change is hard. And sometimes taking a pill is just a lot easier. And sometimes going through IVF maybe in their mind might be a lot easier. So, we recognize that too. But I still think it's important to remember why, the ramifications of that decision too. It's not just, oh, well, this is my path to getting pregnant. It's like, well, I'm also creating babies and not having those babies come into life and destroying or, potentially getting pregnant with multiple children and not having all of them or not having healthy experiences. So I say all that, sorry, slight digression there. Just to say why it's just important and it's helpful if during those younger years, women and even men are learning about their bodies so that we're not sitting with 30-year-olds anymore who are saying, I'm not able to get pregnant. I want to be pregnant. And now I have to start from scratch. And then we're waiting, over a year, 5 years. We're waiting. I don't know how long it would take at that point, right? A couple of years, maybe faster now that we have more doctors that are trying to seek out root causes. But that it can take longer than you want, because when you're in the mindset of I want a baby yesterday, waiting a month is hard. Every cycle feels hard. And so anyway, we're going to address where you're at right now. If you are the 20, late something, 30 something year old wanting to get pregnant, not able to, like, okay, well, we got options, so we can get started now. It's never too late, right? We can try it. But ideally we want to change this culture and have it be more of a preventative approach where we know about this, women understand their body, they're addressing those reproductive diseases and disorders early on in their reproductive years when they're adolescents. We're not just pumping them full of synthetic hormones and putting them on birth control. So anything, Emily, you want to say about that?
I was just going to add, I would say this is also for, the person that got married later in life and perhaps they never used synthetic hormones or anything like that, but they're wanting to try to achieve, and that's not happening as quickly or as easily as they were expecting. I've seen that with couples, and so yeah, there's hope for you if you get married at 38, 40, you're trying to have a baby in your early 40s. That's still possible to have healthy pregnancies.
That's a good point, Emily. Yeah. I think that also, it is also important to say that as we get older, it is harder though, which speaks to, the overall cultural trend of everyone waiting later to have children when we know our healthiest reproductive years are in our 20s and early 30s, really. So, but 20s definitely our prime time. So yes, definitely not without hope, but age is one of the factors that can impact the health of your fertility.
Sure, perhaps, age along with underlying things, that can put a lot of things against you. But
Exactly.
yes,
But not impossible.
but
for
not
sure.
impossible. Yeah.
Okay, so let's go over some different resources. So I guess I would maybe break the medical professional world up into these two different camps. And one is just what we'll call like mainstream medicine, right? So those are here's the pill, kind of like giving you I don't know what's going on. Here's a pharmaceutical intervention or an artificial reproductive technology intervention. And this is not an episode that we're bashing doctors. Most doctors are really wonderful people and they're doing the best they can with the information they've been given. I worked with an organization, that's one of the resources I want to bring up today, called FACTS. And they educate medical professionals about the science of fertility awareness. And it was through that job that I got such insight into the medical school curriculum to find out, like, wow, they know not very much about the woman's body, about the reproductive cycle, and more so, like, they do know some things, right? But more so, they're not trained in how to address underlying causes. So give them some grace. But you can be informed as a patient for sure. You don't have to rely just on the medical professional. Okay. So, so that's one category, right? We'll say just kind of mainstream medical professional. The second category would be more restorative reproductive approach. So you could Google even that, like restorative reproductive medicine. There's a wonderful organization, it's a conglomeration of medical professionals. It's called the International Institute for Restorative Reproductive Medicine. And even if you're not a medical professional, you can go to that website and you can read a lot of research, kind of get a lot of insight into different approaches for addressing different reproductive diseases and disorders. And so this is even applicable for young women, for women of all ages. If you're not trying to achieve a pregnancy and you just have some type of reproductive issue, there are alternative treatments. So we're going to kind of lump that in with this episode of, kind of really looking at IVF. But IVF is a resource or is a option solution that most people choose because they're having some type of infertility issue, right? Like they're not able to achieve a pregnancy, which is actually a sign of a disease. A disease state for the reproductive system is not being able to achieve a pregnancy, because being able to achieve a pregnancy is actually a sign of health. Like things are working well. To be able to achieve a pregnancy, carry a pregnancy to term, and have a live birth, singleton infant is just wonderful. That's the body working well. So that's the first resource I wanted to bring to today is the Institute for Restorative Reproductive Medicine. And I'm going to list all these resources in our show notes so you can go to them. But it's encouraging to see it. And if you are a medical professional listening to this, looking to learn, they do a lot of webinars on the most recent research in this field and really trying to look at root causes and different treatments, cooperative treatments that complement the natural cycle. So that's my first resource.
Mm-hmm. Yeah. So one thing that I think about resource-wise, I think about my own situation and things that I struggled with, which first and foremost was endometriosis and polycystic ovaries. So polycystic ovarian syndrome, PCOS. And to speak on PCOS, PCOS has many different shapes and sizes, symptoms, and really the PCOS diagnosis is kind of an umbrella term for what could be a few things going on. And there is a woman who, her name is Claire Goodwin. She's a nutritionist, and she has created the PCOS nutritionist. I'm pretty sure that I wrote that. Hold on just a second.
That sounds awesome. You know who else that made me remember her? I hadn't thought about her before. Is Dr. Laura Bryden. I know I've brought her up.
I thought you were going to talk about her for sure.
Yeah, I had totally forgotten until you mentioned PCOS. I was like, oh, that's right.
Yeah.
Dr. Laura Bryden, she's awesome. She's a naturopath in Australia, I think New Zealand, actually. Yeah, New Zealand. Anyway, her book, I love her book. The first book she wrote was The Period Repair Manual. I have it. It's great. But she came out with 2 other books I really want to get, The Hormone Repair Manual and Metabolism Repair for Women. So she's got a great website. I'll link it below too. Her blog is awesome. She does a lot on, she's done stuff on PCOS, on all the different is it PCOS, the 4 types of PCOS? That was her episode or her blog I really liked a lot, kind of explaining what PCOS is, and there's different forms and manifestations of it and ways that you can cooperatively address it too. Anyway, go ahead, Emily.
Well, no, yeah, Laura Bryden is a wealth of information. I would highly encourage anyone to read her books. I'm just like Amy. I read the Period Repair Manual, but I would love to get my hands on the other 2. This woman, Claire Goodwin, so the website is thepcosnutritionist.com. And like we said, Amy will link these. But she also has a podcast and that sort of thing. But she also has different groups. And one of those in particular is called the PCOS Protocol. And I remember when I was struggling with trying to get answers and root cause and all of that sort of thing, I signed up for one of these programs at the encouragement of another friend that had joined her group. And
that's cool. How do you do that?
Yeah, at the time, this would have been over 5 years ago. So at the time, I was under the impression it was relatively new, and it was pretty personalized, as much as you wanted it to be. If you were, reaching out to her and stuff, you had pretty good access to her. I don't know if anything has changed over the years. I know that she's gotten bigger. And she has a really good following, and I think she's helping a lot of women and couples. But once again, I'm most positive she's out of Australia as well, and that's a great place to go for PCOS because it is such a broad term, and some women deal with some of the symptoms, for example, insulin resistance, and some women don't. And she is really good about figuring out what type of PCOS you have and then being able to help you with that. And so anyway, she's someone I would definitely recommend listening to or going on her website for sure.
Awesome. That sounds great. I haven't heard of her before, so that's why I always love learning about new. The other person we should lump in there with is we should also specify too, in case people care about that too, whether someone is like a faith focused or has any type of faith component. So like Laura Bryden will also talk about, I think she will sometimes promote the IUD. So she's not of a faith background. So you have to go in there and just be informed about what it is you're looking for, but her content is so good and she has so much great information. So that's why I like to promote her a lot. And I just usually caveat it with, just be aware you might also read some of this other stuff, but take what you like and leave the rest. So
I would agree with all those things with Claire Goodwin. There's definitely going to be things that come up that you might not agree with, but there's still a great wealth of information
Right,
from these
exactly.
women. Yeah.
The other person I was going to lump in with that group is Lisa Henderson Jacks from the Fertility Friday podcast. She's great, and she has great people on her podcast. Also, not of a faith background in that, like, very fertility, very underlying cause focused, super smart. She's got resources for medical professionals and for fertility awareness practitioners and for just the lay woman wanting to learn more about her cycle. Her book, The Female Vital Sign, I think we mentioned it on like one of the first episodes. I mentioned it because I have it and read it, is great. So you can learn to chart through her website too. Anyway, she's also really great. So I'll lump her in there with just like kind of non-faith affiliated. We'll sometimes talk about things that I wouldn't agree with necessarily, but overall has just like really good messaging and good resources. And her guests are great sometimes too. So, okay. So the next one I'll bring up is the organization I used to work for. So I might have a slight bias there too, but it is still awesome. Dr. Marguerite Duane is responsible for it now. She had a co-founder for it, but it's called FACTS. It's the Fertility Appreciation Collaborative to Teach the Science. And so they are a collaborative of medical professionals and fertility awareness educators who are trying to promote fertility awareness literacy in the medical community. This is, nurses, doctors, chiropractors. Like they do not discriminate in whatever medical professional you find yourself in. They want you to know because they believe, you could also be a great resource to refer someone to somebody else. If you just have like even basic knowledge of, women are presenting with these issues, maybe instead of referring them to an IVF clinic, I can refer them somewhere else. And so anyway, FACTS is great. Even if you're not a medical professional, they do have resources that if you want to take something to your medical professional and provide them with some information, you have that kind of a good relationship with them, you can do that. You can go on there just to learn about charting. This is also a great website I'd like to send people to learn about all the different methods because the FACTS organization, Facts About Fertility, they also don't discriminate on the method. So they don't kind of bias one method to the other. They talk about all the biological markers and different, evidence-based methods. They have a lot of the research behind the different methods and what makes them effective. So so that would be another great resource just to peruse their website. Their blog is really great too, and it's very current. So the blog, it's often written by medical students who are digesting different research, and they've got really good information on apps. So that's another thing that I like about them is they've got really good information about the effectiveness of apps. They try to stay really ahead of the curve on getting that out there because, like I shared before, not all fertility apps are created equal, especially if you're trying to use them to really track your cycle and are relying on them to give you data about when you're fertile and when you're not fertile. So their blog is really, really great. So that's the next resource.
Would you say that resource has a religious undertone, or is it?
No, definitely not. They're not like religiously affiliated. The founder is of a faith background that's very in line with everything we're talking about. So you won't find anything on there that's like, they're not promoting birth control. They're not promoting artificial reproductive technologies by any stretch of the imagination because the organization exists to find alternatives to those approaches. So you won't find that there. Thank you, Emily.
Speaking of Margaret Duane, it makes me think now is a great time to talk about the St. Paul VI Institute and what that can provide women and couples. And so the St. Paul VI Institute is located in Omaha, Nebraska, and was created by Dr. Thomas Hilgers and his wife and two nurses. And from that came a charting method called the Creighton Model Method, which is something that you can be trained on how to teach women and couples how to chart their cycle. And that's something that I've been trained on how to do. And I know Amy's worked with women and couples previously. And with this method, then you can meet with different physicians that have been trained on how to read and interpret this charting. This term for these physicians would be Creighton Model Medical Consultants. And once again, they are not discriminated upon in the sense of it could be your chiropractor, it could be your nurse practitioner, it could be your physician, your OB, or your family practice doctor. And so anyone can, these doctors can be trained on how to read these charts. And so with the interpretation of the chart, then can come a lot of recommendations or help with what might be showing up on the chart. And so once Dr. Thomas Hilgers and these women developed the Creighton model method, then from that, because of what they were seeing on the charts and, for example, unusual bleeding patterns or long cycles, that sort of thing, they wanted to know, how do we treat these things in a natural and restorative way? And they created NAPRO technology, which is just stands for natural procreative technology. And so you may see the word NAPRO technology as you're sifting through different groups and things online. And what that means is these physicians are going to try to get to the root cause. And there are ways to treat root cause issues using NAPRO technology, and which is meant to naturally restore what's naturally supposed to happen within the female body and between the couple. And so there's different levels of physicians connected to NAPRO technology. And I don't know if we want to get into all of that, but it just makes me think, there's NAPRO surgeons, which have been trained through a fellowship program at the St. Paul VI Institute in how to treat these underlying issues, specifically with different surgical techniques. And those are the types of physicians that you want to work with if you're trying to correct some root causes that might be going on internally. I want to plug a physician that is a NAPRO surgeon. She completed her fellowship around the same time that I was being trained on how to teach the Creighton model method. And her name is Dr. Naomi Whitaker. And I have a lot of women in couples that when I'm meeting with them, they're very familiar with her because she has a really big presence on Instagram when it comes to NAPRO technology. And so most of these women in couples are telling me about what they've seen through her Instagram posts. So we'll link her handle, but it's NAPRO_fertility_surgeon. And she's done a lot with social media and education about NAPRO technology. One thing that I do want to add about that doesn't get brought up, usually or in the same or at the same time, is something that Dr. Thomas Hilgers has created when it comes to how these physicians treat these underlying issues surgically. And he's created what is named pelvioplasty. Pelvioplasty is a way to repair and correct these issues surgically in order to minimize the development of adhesions as the woman is healing from the surgical procedure. So this is a really big deal because this type of practice or this type of treatment, pelvioplasty, is not practiced among mainstream doctors. I don't know if that's the right term, but your typical doctor, your typical OBGYN is not going to practice what we call pelvioplasty. And so I would encourage any woman or couple to look into what that means and how important that is when a woman is going through any surgical technique in order to try to correct or restore what's underlying the problem that's going on, the root cause. So I'm a huge proponent of working with a NAPRO surgeon and making sure that they're using that pelvioplasty technique. So
I think listening to you share about that just reminded me that as patients, we have to remember that we are receiving a service from someone who's offering us services. And so being informed and not being afraid to ask questions about their technique, about their training. Like it's so funny. I think in the medical world, sometimes we walk into the office and we just are, bowing down at the white coat as if they're, have all the, like, just that, okay, well, whatever they say goes. And I remember that was the most empowering moment. I was actually a college student and I had a friend who was older than me. And I was going to the doctor for something and I was feeling nervous about it. And she looked at me straight in the eye and she said, Amy, remember that you can say no. Like the doctor is working for you. You are the patient. And I was like, oh, it was so empowering, Emily. I was like, yeah, I am. Like, that's right. I don't have to say yes just to whatever you give me, It was like, and it seems so silly and obvious, that of course that's true. But I didn't have that mindset when I would go to the doctor. It was just, okay, whatever you say, yes, doctor, like I'll do this, as opposed to, respecting their professional knowledge and their expertise, but also saying like, okay, well, what kind of being able to walk away. Like, what service are you offering me? No, thank you. I'm going to go and seek a second opinion. I'm going to go find something else.
Right. And I think we're so easy to accept what's being offered because we want help. Right. And so especially if you've seen multiple people and somebody's offering you what you think is going to be helpful in those moments, for me, sometimes I'm not even thinking about extra questions. I'm just like, oh, praise God, I'm going to get what I think I need. And you just only hope that that is something that is really going to help you long term.
So true. Yeah. You're in a vulnerable state. Mm-hmm. So that's so true. Yeah. When you feel like you're drowning and someone throws you a life jacket, you don't even pay attention if it's like wrapped in barbed wire. It's like, whatever. Yeah. I will be bleeding, but as long as I'm not drowned,
might be half inflated. But...
Right. Yeah. Exactly. Or half deflated. Yeah. That's probably better. Barbed wire. That's a little intense. Yeah. Okay. The next resource I wanted to bring up is FEM and FEM Health, FEMM Health. And they've got medical professionals you can work with as well through that website. You can learn to chart with them. You can find someone who's trained to teach you how to monitor your cycle. They've got a great app that I have now been using. Just this past cycle, I started using it because I started working with a doctor with them. And the app is great. It's free. It's so user-friendly. I'm really enjoying it a lot. Again, not for really the purpose of like interpreting anything for me, but for storing information. It's really, really great. So, I like that it's free. So that's really great. So anyway, they've got a ton of great information on their website. So I'll link them below too. So that's my next one. Do you have another one, Emily?
The two that I've shared are the two that, really come to me when I think about all the help that they can offer, and the ones that you've talked about, I completely agree with.
Next to that one, I thought about when Emily was talking about the doctors trained in NAPRO technology, is the Hormone Genius podcast. That's great. Emily and I both really like the Hormone Genius podcast. Teresa Kenny is medical consultant in the NAPRO technology, and then Jamie is a fertility care practitioner. So anyway, they're both really great. Their podcast is great. They've got good hosts, good topics, good resource.
They are wonderful. I feel like they offer women so much information. Right. It's really wonderful.
And they both come from a faith perspective. They do have diverse guests on their podcasts, but again, they're aligned with just the movement of seeking root causes. So they're going to promote options that go after the root cause. Okay, the last one that I had that I could think of was is Natural Womanhood. And that's a really great website as well. It's got a great blog, talks about a ton of different health issues, promotes all the different methods for fertility awareness. A lot of women sharing their stories, which is just really powerful. I feel like it's just really powerful to have that as a resource too. You can learn. They just have so much. So yeah, Natural Women has grown a ton. And so I recommend that as a resource as well. So I will, and that is a resource as, if you're struggling with any type of reproductive disease or disorder, trying to seek out IVF, Natural Womanhood is not like a conglomeration of doctors. It's kind of like a grassroots women coming together to talk about their experiences with artificial reproductive technologies, with hormonal birth control, with the alternatives they found. So you can just really kind of go to that website. It's like finding community and finding good resources to correct and maybe like be redirected to other areas, but natural womanhood is really great too. So that's all I wanted to say for resources. And then, yeah, Emily, you want to talk about the bill?
So something that's going on in real time. So it's July of 2024. And Newsweek in June of 2024 put out an article online about a bill that is going through the Senate in order to expand access to funds, to money that can be used to get to these root cause issues. So this is something that's going to be voted on, and I don't know when, so I don't have that information. But I do know that you can contact your senators and ask them to please vote yes for this bill. The bill itself is called the Reproductive Empowerment and Support Through Optimal Restoration Act. So the bill is called the Restore Act. And this bill takes a proactive, pro-family, and pro-woman approach to addressing reproductive health conditions and infertility through restorative reproductive medicine. So this is very important. And one angle that's been taken with this bill that I think is interesting, but it's been used, I think, to get support from a wide base, is even if a couple is trying to achieve pregnancy through IVF, if they can naturally restore some of the hormone imbalances and different things that might be going on, they have a higher success rate with IVF. And so obviously, I am not promoting this to be used in conjunction with IVF, but I think that that's interesting that that is one of the approaches that's being taken, as well as for couples that are not interested in IVF, that want to get to the root cause and achieve a healthy pregnancy naturally. So this is a really important bill that I would encourage anybody to write their senators about and tell them to vote yes on the Restore Act.
Okay, awesome.
Yeah.
Emily, I'll link to that Newsweek article as
That's
well
great.
on the show. Anyone that's
I'll
interested
send
in
you the Naomi Whitaker and the PCOS website, that sort of thing.
Perfect. Okay.
Okay.
Sounds good.
Okay.
All right. Thanks so much, guys.
Thank
Bye,
you.
Emily.
Bye.
That wraps up another episode of the NFP podcast. Thank you so much for joining us today. We hope you found our discussion enlightening and empowering. Don't forget to subscribe so you never miss an episode. We'd love to hear from you. Please connect with us by sending us an email with your questions and stories to thenfpshow@gmail.com. We'll be back next week with more insights, tips, and heartfelt conversations about natural family planning. Until then, love responsibly.